what is happening in the headlines, we now get straight into the discussion that I had mentioned when we were beginning the show, and that is on the rise, or rather the rising burden of cancer in the country. And the question that we are asking ourselves is where are we exactly? How far are we in this fight against cancer, and what is to be done? What is yet to be done? What are some of the challenges that are facing the people who are in charge of trying to find out what can be done and the strategies put in place on this particular matter, which is cancer? As I also mentioned, that cancer is the third leading cause of death in this country and the second leading cause of death when it comes to non-communicable diseases. And joining me for this particular discussion is none other than Dr. Elias Meli, who is the CEO, National Cancer Institute of Kenya, and he is here to just delve into this matter and get to tell us where exactly we are as a country matters cancer. Welcome to the show, Dr. Elias.
Thank you.
You're doing well?
Yeah. Good morning, Vivian, and good morning, viewers across the country. Want to appreciate KBC and Vivian, who is hosting me this morning, for this opportunity to discuss with Kenyans on a matter that is significant at this point in time.
Yeah.
And before we begin, I would really want to, send my heartfelt sympathy for the people of Gaza, who, from the news we are seeing or we are hearing, it's becoming a graveyard.
Yeah.
And even those who died in the road crash. At the same time, those who unfortunately have also lost their lives to cancer. As you rightfully mentioned, Vivian, this is one disease that it is really giving everyone sleepless nights.
It is.
Everybody's worried. What is going to become of me? There are many people who are being diagnosed with cancer who they never thought they would have, been diagnosed. No risk factors, according to them, that they've been exposed completely. Yeah. But we're going to deliberate and on this in a short while. For sure, the burden of cancer globally is increasing. It's not only in Kenya. It's is one disease that every other country in the globe is worried, just like we're worried about climate change. Crisis that we are seeing across the world. Cancer is also that disease that aligns itself to the global crisis, including the economy that is struggling. And of all the diseases, this is one disease, unfortunately, that is causing a lot of physical, harm. It causes psychosocial challenges, economic. People, get depleted of all their resources because of one very expensive disease. And unfortunately, after investing all the resources, we find ourselves also, these patients losing their lives, which is most important. If you look at the statistics globally, we are worried that every year up to almost 20 million people being diagnosed with cancer, and our country is contributing to these statistics, where the burden in our country has estimates of more than 42,000 Kenyans being diagnosed every year, and unfortunately 70% of them, they succumb to this disease. We are looking at a mortality rate of 70%. What does that mean? For every 100 people diagnosed with cancer, 70 of them dies, by the end of 1 year. And if you break that down into male and female and children, we are seeing the burden of breast cancer very, very high in those who are diagnosed, new patients, while cervical cancer is head to head, amongst our ladies, amongst our girls, our mothers, our grandmothers. It is of concern because cervical cancer is one disease that should not kill anybody.
Yeah, because there's the HPV that we can be able to get and, avoid, or rather not get into the risk of getting cervical cancer.
Correct.
But what is wrong? Is it that we're not doing enough awareness? Being that, cervical cancer, as you've mentioned, is on top of the list of the number of people who are dying, due to cervical cancer. Is it that we're not putting it out there enough?
Well, the reason why I'm here this morning, Vivian, is to create that awareness so that those who unfortunately might not have had, and we're using many different ways of now to increase awareness in the community. And I really want to appreciate, one way of creating a lot of attention into cancer care is establishment of the National Cancer Institute of Kenya, which is a dedicated agency under Ministry of Health to deal with matters cancer specifically.
Yeah.
There is no better time that our country can address this problem than right now, when we have resources committed through one agency to, slay this dragon. And before I come back into the details of cervical cancer, because I really want us to dwell on what we call preventable cancer, that risk factors are well known and interventions are right there. We are talking of among the males, prostate cancer is leading, and we have cancer of the esophagus coming second, and it's affecting both male and females. We have colorectal cancer. These are cancers of the large intestines and the rectum. It's also another huge challenge in our country, among the leading. And we have lately seen even cancers that we would not think would be prevalent in low middle income countries, like Africa and Asia and East Europe and Latin America. But now we are seeing them. Lung cancer is on the rise. Every type of cancer, brain tumors, name them, liver cancers, they are here with us. Head and neck cancers, they are here with us. And among our children, because we always want to sensitize about children as well. Being the Chief Executive Officer of the National Cancer Institute of Kenya, I have to address all the matters, of the entire country, because unless every corner of this country gets to be aware about cancer, then we will not achieve our mandate, which is cancer prevention, towards reducing the burden of cancer in our country. And if you look at 75% of cancers, and it's good for Kenyans to be aware that we run a huge challenge. 75% of cancers are diagnosed in the West, high-income countries, while 25% are diagnosed in low, middle-income countries. But unfortunately, 75% of deaths occurs in low middle income countries. So we are in a country where we are faced by a huge challenge. Now we have, cancer being one huge disease, but if you break it down into specific diseases, then you will understand that we are going to handle cervical cancer separately, we'll handle prostate cancer separately. This month is Prostate Cancer Awareness Month. In fact, we are always being asked as men, no shave. Did you know that, Vivian?
No shave.
I know right now I'm expected to be...
No shave November, yes, it is.
No shave November, right?
Yeah.
Just to stand with the men who are diagnosed with prostate cancer and probably, create awareness towards what are the risk factors and how can you prevent yourself. Yeah. So we look at our government because this is a challenge that is facing Kenyans, and it's the responsibility of every government to put mitigating measures in place towards, addressing the health issues. As much as health is a big challenge in our country, there are specific conditions that we really need to give additional, attention. Let me appreciate our government. If you look at the Kenya Kwanza government through, His Excellency the President, Dr. William Samoei Ruto, health was a huge, huge agenda, and in their manifesto, it is cut out. Recently, the president launched UHC, Universal Health Coverage. This is going to be a game changer, including, prevention of cancer and early detection of cancer through community health and primary health care. And we are glad that at this point, every Kenyan in this country will afford, basics of cancer care, from prevention in the community, using the community health promoters, who at this point in time, we are skilling, we are also reskilling and unskilling, because some of them have been community health volunteers. So we're giving them more information so that they can address this challenge in the community. And with focusing on prevention, it is documented in data that if you are going to invest, $1 in prevention, you are going to save up to around $15 in treatment. What does that mean? We are going to reduce the cost of expenditure in our healthcare in general if we put more emphasis on prevention. In our country, for the longest time, we've been focusing on curative treatment. To treat cancer, Vivian, is very expensive. And I know viewers agree with me that people have sold, you know, all they had. And now our country has come through for them. Remember the recently laws that the president assented to, the bills that now are laws, you know, to actualize universal health coverage. The former NHIF, which is now Social Health Authority, is going to have 3 funds. Number 1, primary healthcare fund. It is going to handle issues on level 1, level 2, level 3. Yeah. We are asking Kenyans that it's now yourself to present to the hospital when you have a challenge. And we have these community health promoters to teach you on the risk factors and how to prevent. And at level 4, 5, 6, which are our county hospitals and sub-county and national referral hospitals, you have social health insurance fund that is going to take care of you. And further, if you exhaust that, our country has prepared for you through critical illness, emergency and chronic disease fund to take care of anything that your social health insurance fund has not addressed. So cost will not be a barrier anymore in our country. And we really have to appreciate our president. We have to appreciate our leadership at the Ministry of Health through our Cabinet Secretary, Madam Susan Nakumicha, and the entire leadership because of this.
Now, just as you've mentioned, the government is really working on easing the burden when it comes to cost, the cost of treatment of cancer as well as other major diseases. Now, what other strategies maybe is the institution putting in place in the prevention and the control of cancer?
Thank you very much. The National Cancer Institute of Kenya, which is the prime institution to face this head-on, was created a while back. And right now it is re-energized, it is rebranded, it is working now towards really addressing the burden. We have one of our functions is prevention, as you've rightfully put it. So we are doing cancer mainstreaming across ministries, departments, and agencies. An agency like KBC, you have so many staff. From the National Cancer Institute of Kenya, we will be visiting you if at all there are any risks that are posed by working at KBC. But let me go to specific areas where we know there are major risk factors, like our Ministry of Agriculture. There is so much exposure of chemicals in the community, in the farmlands, and it's really a huge challenge that our people are ignorantly using chemicals without any personal protective gear. And there has been chemicals which have specifically been associated with cancer causation. Tobacco, alcohol, these are the leading, risk factors for cancer. And in our country, it is good morning. I can see a cup of coffee or tea over there. I wish you could drink more coffee and tea than we are using alcohol. And those who are using cigarettes, because it is one universal risk factor for all types of cancers. And if we're going to reduce this use in the community, we will have cut out. We are looking at diet. Whatever you took for breakfast, lunch, are you sure that it is healthy? Are you sure it's in the right quantity? Are you sure it's at the right time? So we have to mainstream on this physical inactivity. By the roads of Nairobi this morning, it was like a parking lot. People are on their vehicles. People are hardly walking. If you go to Europe, people are riding bicycles. But in our country, as much as the economy is tough, it's very interesting that we are buying more cars and we are becoming more inactive. These are risk factors because we cannot metabolize a lot that is within us, which unfortunately they pose risk factors for us. Obesity has been flanked as one of the risk factors for cancer because when you break down fat, ultimately it becomes some hormones that would risk, you being diagnosed with cancer, including breast cancer. So if you look at these risk factors, if we're going to address this, 40 to 50% of cancers are actually preventable. If we are going to make sure we observe, make sure we reduce these risk factors where it is possible. And if we are going to, address this issue, the mortality rate of 70% may come down to less than 30%. So one of the major strategies at the National Cancer Institute of Kenya that we are putting in place is to make sure that prevention, we think prevention, and we create awareness on prevention people do not know. And if you look at cervical cancer, we had mentioned earlier on, cervical cancer, we have, WHO call to eliminate cervical cancer by 2030. And three simple strategies, which we are now putting in place. 90% of our girls by 15 years, they should have been vaccinated with HPV. It's available, it's affordable. Government is going to fund it. So none of our girls should not be vaccinated. I know we are facing a lot of challenges on the myths and perceptions. People are worried that it may cause infertility in our girls, but that is not really, the real thing. If you look at countries who began vaccination for cervical cancer in the 90s, Australia is going to be the first country. Many other countries in Europe are going to eliminate this. And we are now asking our ladies, okay, by the time you are 35 and 45 years, you should at least have gotten screening for cervical cancer. And we are asking you, you can do a pap smear, you can do HPV DNA test, you can do VIA, villi. These are all modalities that we are using to screen cervical cancer. But the best, that has the highest sensitivity and specificity, if you can, that is unlikely to have, misses, is HPV DNA test. It's a bit costly, but we really want to also go for quality. Because this is one other thing that we are focusing at National Cancer Institute of Kenya, to make sure when you get diagnosed with cancer, it is quality treatment.
Dr. Melly, it's really unfortunate that I have to cut you short because we need to wind up this conversation. But I believe that you are going to avail yourself maybe some other day so that we get
I could just end with the last
very
strategy.
Quickly because of time.
Yes, so that we just get done with this cervical cancer, because I mentioned that it should not kill anybody in our country. The last bit of the strategy is those who are screened, because we're emphasizing screening. Today we'll not talk about treatment. Let me just end at screening. When another opportunity presents itself, then we can talk about treatment, and so that we can educate our people. So the last bit is treat all those who are diagnosed with cancer, 90% of them. And if we do that, Vivian and our viewers across the country, we will eliminate cervical cancer. Thank you very much for having me here today.
We are looking forward to a time when we will be able to eliminate cervical cancer completely. And as you've put it, we're looking by 2030, we should be done with cervical cancer. Now, Dr. Melly, thank you so much for joining us. We are going to definitely find more time to get into this, if possible, this month, so that we can get into prostate cancer and that you can educate us more on that. Now, from here, I'll take a very short break, but Mike Megwe is up next on Health Matters as well.